Okay, so this is another interesting case, something quite different. I thought it would be worth talking about. So this is a male patient, obviously in his early 40s, who basically presented complaining of a feeling of heaviness in his lower face. In fact, the words he used were that he felt like when he looked at himself, there was almost a muzzle around the middle/lower part of his face, which is an interesting thought. And when you try and diagnose, I guess, why did he feel like that? I think that there's a lot of volume loss in the mid-face cheek area, and so that was really the mainstay of this treatment. So with so much volume loss, this was really about doing this gradually and steadily, which is exactly what we did over a couple of sessions. So first of all, my approach was in kind of session 1 was to treat the lateral cheek, the outer part of the cheek first of all. I think that when you're addressing the male mid-face, it's really important not to overdo it. Making it project too much anteriorly starts to make a male face potentially look overly feminized. So this was about, first of all, trying to get as far as we could in terms of having an effect on the mid-face and the lower face indirectly. See how it went, let it settle down before we actually address the mid-face directly. So we did session 1, and then we had a look at it a couple of weeks later, and both agreed that we definitely needed to do something more directly to the mid-face to try and improve the appearance of the mid-face directly, the under eye region, but also see if by volumizing it we could have an indirect effect on the lower face, which is really my preference. I try to stay away really as much as I can from the lower face with filler, and try and affect it indirectly first of all before going there really. So that's exactly what we did in this case, and what we've achieved is an indirect improvement in the lower face, which was the kind of core aim. As well as that, we have improved this kind of quite tired, drained look from his face generally. And just as a bit of icing on the cake, we did a little tiny bit of tear trough filler just to kind of really go as far as we could in terms of improving the under eye region, and this worked out really nicely. I hope you enjoyed this content. If you did, hit like, subscribe and share to see a bit more.